Mainstream, more accepted than ever. Look for no further than athletes, television shows, models showing off their ink.
It's become quite the topic for teenagers as they get older. I know it came up in my house. Does it come up in yours yet? So what do you do? Dr. Don Shifrin's here to help us navigate that topic. It's not uncommon, is it, Dr. Don, for kids to start broaching this topic as they get 15, 14, 13, 16, 17?
Well, as you look at the millennials, 18 to 35, about somewhere between 25 to almost 50% of them are either thinking about or have got a tattoo now. So the topic is really mainstream, and it's thought of as a lot differently. Body art's thought of a lot differently now than it was 30 or 40 years ago, when very few people, or people that perhaps had a little shadier past, sported tattoos. But there are some things that we'd like to pass along to parents and also to physicians in terms of bringing this topic up. This is, again, one of those topics that are tough to discuss with teenagers: sex, drugs, alcohol, tobacco, smoking, social media, that we'd like to have more enlightened discussions about than if teenagers bring up, Mom, I'd like to get a tattoo, or Dad, I'd like to get a tattoo. We talk about the acronym FAT, facial expression, attitude, and tone, rather than looking and going, no. That's not gonna work.
I put body art and body piercing sort of in the same category for my family.
Yeah, yeah.
Probably not the best parenting, but I said, no, you need to be older. I'd prefer you be, 21.
Well, it's that initial shock that you have, right? When your kid says, I want to get a tattoo. I bet you're not alone on this one. This is happening a lot.
It is happening a lot, and fortunately this state is one of 45 states that says that you have to be 18, and also the state licenses tattoo establishments. And what you want to do if you're going to go with your youngster who's now 18 to get a tattoo, you want to make sure that the tattoo establishment is like a dentist office: sterile gloves, sterile ink, sterile needles, because and also that you want to make sure that your youngsters had immunizations. There are some side effects and precautions you should take after you get a tattoo. You want to make sure you get discharge instructions. And there can be bleeding, there can be pain, there can be blistering a little bit. But most teenagers make this decision and say, it's okay because it'll be easy to take off if I don't like it.
Not true.
This is who I am, this is who I want to be, this is the art I want. But there are some regrets, and the number one regret that we find with people is, I was too young, I didn't understand it, and I really don't want it now. But removal is not only painful, it's expensive.
Yeah.
Somewhere around $300 per square inch.
Yeah, I got a friend I could bring on right now who has been through this, who says that is not the way you want to go. It is so painful. So is there anything that parents should be saying, or information we should be telling them that might dissuade them?
How do we broach the topic? How do we what's the conversation?
And that's a great question. Like anything, you want to find a teachable moment. I saw that so-and-so on TV, The Rock, whoever, has tattoos. Are you thinking about getting a tattoo? Are any of your friends thinking about it? Let's talk about this. And let's find out the why you want to get it, what you want to say. What does it say about you? Where you want to get it? You want to get it on your neck, because about 75% of youngsters that have had a tattoo will go on to say to people, I believe that it may impact my ability to get a job or during a job interview. Right. And attitudes may change as we progress with more people getting tattoos. But right now, again, it's looked upon as not quite mainstream for younger people. And also, when your youngster goes to college, it's a wonderful thing to discuss, not only sex, drugs, rock and roll, but also when they go to college, talking about, when kids come back from college, and I've had this happen many times in my office, when kids come back and sporting tattoos that they got perhaps from peer pressure. So parents should be saying, let's have a calm discussion, and if it's an urgent thing, if they're 18 and they really want to go without a parent permission because they can, let's talk about maybe having like the firearms. If you go to buy a firearm, there's a 5-day waiting period. And, parents maybe should start saying, let's talk about the why, let's talk about the where, let's talk about the decision making, let's talk about the precautions and maybe regrets and the rules. Yeah. But, I'll give you a firm maybe, and let's come back and talk about this.
I know with my son who was talking about it, and we said, will you please at least wait till you're out of college and you're a little bit older. But we also suggested, why don't you take a marker, a permanent marker, and put something on your body somewhere and live with it for a month and see if you still like that, whatever you put on your body. in 2 weeks and 3 weeks. And if you still like it, then maybe you might actually like a tattoo. But we're thinking that maybe you still won't like it after a month. Can you live with something for a long time before you decide to make it permanent?
That's a wonderful philosophy. However, most teens are a little more impulsive than that.
Tell me about it.
And the modus operandi is now.
Yes.
Not soon, not in a minute, now. And so again, the enlightened discussion, the informed decision is what we want to push for. Because this is, again, mainstream, and most kids are going to go on to say, I really want this because I saw it, or it really reflects who I am. But remember, as they get older, age, tastes, and their appreciation of the art, and also where it is, the skin may expand. Again, difficult to take off.
It's going to move on you, girls, as you get older.
And one last thing is,
you think it starts on your hip, it's moving down. Oh, trust me.
I'll trust you on that one.
Yeah.
The other thing is there are
15
some
seconds.
inks that are removable now. So you might ask for inks that are easily removed rather than permanent inks.
All right. Dr. Dunn, thank you.